Hello, I am Dr. Cate Dementia Coach, also Cate McCarty. I have a PhD in aging studies from the University of South Florida. I work as a professor with National University, and I work mainly as Dr. Cate Dementia Coach. My experience goes way back 40 plus years, and our presentation today was initially entitled Normal Aging versus Dementia. And I'm going to re-script that a bit for many reasons. One is my expertise is dementia. I've spent most of my life around abnormal aging. It was a shock in the University of South Florida when I learned that less than 20% of people end up in nursing homes at the end of life, and I thought everybody did. So there's a lot I have to learn, and I continue to learn as I teach and as I grow and as I present, which we know is very good for the aging brain. So rather than a versus, I would like to say we're going to discuss aging brain change. Not all of it is normal. Some of it is different, right? And I do that also because there's a lot of stigma around the word dementia. I wrote a blog at one point called The Big D. It's the new cancer. Particularly because as we, as baby boomers, rise in number, we're all very frightened of what that could be. So one of my missions in life is to destigmatize what abnormal brain change is. So in that way, I'm going to start at the dementia part of the equation, which, bear with me, I will try to intertwine them, and I promise I will share the aging brain that will change and will have some forgetfulness. The important take home is it's about intensity and frequency. So if I forget an acquaintance that I just met, and I notice for myself, name tags help me remember. I always give out name tags at all my events, and I always use a dark black marker so I can see the name tag. Well, that helps me learn the name. But if I forget someone's name, maybe didn't have a name tag, maybe it was short, that doesn't mean I have dementia. It means I have an aging brain. My brain's not quite as young. It's showing some shrinkage. There is normal brain shrinkage as people age. When we go to the neurologist, we have some of that in our family. He will say the shrinkage hasn't increased beyond normal brain shrinkage. So that lets you know that we all have age-related brain change. Brain change is a much friendlier way to say dementia. Now, that being said, we have 3 types. And why is it important to know whether it's normal aging or it's abnormal and we need some help? Well, it's important because of these 3 types. We have primary dementia, which is a diagnosis, say, Alzheimer's disease. Okay, that's a primary. But if it's vascular, that's a secondary type of dementia. So let me give you a visual. Imagine a big umbrella, like the big one, the one that the golf people use on the golf course. And underneath there, you have 3 smaller umbrellas. You have primary dementia, secondary. These are the folks that have vascular dementia from strokes, or maybe brain injury. The sum of that from the past, traumatic brain injury, would be secondary. And the third little umbrella, which is why you definitely want to pursue a diagnosis, is the reversible dementias. Reversible dementias are very real. They can be from complicated grief, depression. It can be from medication complications where they just are interacting poorly. Blood clots, tumors, brain infections, all these things that could be fixed. Thyroid, kidney, or liver problems can be part of a brain change. That reversible dementia. A head injury, sometimes we can reverse that impact, as well as sleep problems. One of the things that those of you who have been on this path may recognize, at least when I lived in Florida, the first thing every neurologist does is sends you for a sleep study. Sleep is so important. We are now seeing that hearing, shocking, hearing is so important to brain change. We need to be on top of the audiology frequency, making sure we're testing our hearing, making sure we're using hearing aids. We also need to be very conscious of our sleep scores. We have all these great apps now, so what's your sleep score? And there are lots of antidotes to help, and as a person gets better sleep, often the signs of poor judgment, more forgetfulness than usual, even personality change. I don't know about you, but I can be really cranky if I haven't had a good night's sleep. Those are things that are reversible. So many times I think of the ostrich. People don't want to come forth. They want to assume it's just normal aging. It's what happens, and that's okay, but just imagine you're under that third umbrella. That's irreversible. Let's find out, right? And by finding out, now, we can't always make huge changes, but we can start adapting life for quality of life. And that's my mission, is the quality of life mission. So the ostrich, the head in the sand, I always say in my presentations, see the picture, an ostrich head and an ostrich butt. What's exposed when his head's in the sand? Well, it's a really large target. And that is what happens when we hide and we go into denial. We don't get the resources we could use. So we know dementias, all of them, but in particular, that big umbrella. The big umbrella is a set of symptoms. Now, back in the 70s, we didn't know that. We had many charts, senile dementia. That's no longer a diagnosis. Depending on the expert you speak with, there's over 200 varieties of dementia, which is fairly overwhelming. One of my very favorite resources is the Alzheimer's Association Facts and Figures. They release it once a year, and they have this lovely pie chart. So yes, there are over 200, but we really have the top 7, right? Parkinson's dementia. About 50% of people with Parkinson's start to see some brain change. Sometimes a different diagnosis that runs concurrent, maybe Lewy bodies dementia. But the big heavy hitter still today is Alzheimer's. 60 to 70% of your pie is Alzheimer's. The next chunk is vascular. The third is mixed. And they say 1 in 10, but part of the problem is we only know about whether it's a mixed dementia if someone donates their brain to science. Most of us, or many of us, don't really want all that done after we pass away. So we don't have a lot of data. But what we do see is about 1 in 10 people have mixed dementia, and it's Alzheimer's and vascular combined. Well, think about that. That's heart and brain. And those two health systems, very important. So all the changes we can make for our heart are also good for our brain. They work together. There are many others. There's post-cortical atrophy. There is alcoholic dementia. There's normal pressure hydrocephalus. Sometimes that can be reversed with shunts, or at least lessened. Chronic traumatic encephalopathy, CTE, which is from the brain injuries of, say, football or repeated head trauma. When we look at percentages, as we age, 5% of people aged 65 to 74 have some form of non-reversible dementia. So that's 5%. Then we go to 13.1. It's very carefully orchestrated. And again, this is 2023 stats. Age 75 to 84. So 13%, okay. And it goes to 33.3% at age 85. So we have two they're not modifiable. if you're lucky enough to live long, you're more likely to have dementia. And the three factors in Alzheimer's disease risk are age, genetics, and family history. That last one has proven to me to be very interesting. We're seeing things like acute adverse childhood experiences are associated with increased rates of dementia. So we're seeing a lot of that's why it says family history instead of just genetics, because there's a lot that we're researching. And as frustrating as it is that we don't have a cure yet, we're learning so much. If I had presented on this 10 years ago, I would have stuck with the 7. Now we know there are over 100 forms of dementia. That's part of that uncovering and that constant research. But also, when we look at longitudinal research like the Health and Retirement Study or the Framingham Heart Study, we're seeing other things that are helpful on the path. And as frustrating as it can be to learn at age 65 that you really should have been doing cardio all the time, at least 3 times a week, it's never too late. From a Christian perspective, I always think of it as stewardship. I was given this. What am I doing to take care of it? And that's a challenge. It's also why I constantly am renewing and researching what is the latest on brain health. And a take-home, heart health is brain health. So whatever you do for your heart, you're doing for your brain. But age is the greatest risk factor. And still, look at that, 33.3. There was a time where we were saying 50%. Some of that is the change in our generations. What our parents dealt with is not what we've had to deal with. And so that has changed. We see some protective factors in midlife that maybe you and I were able to participate in, but our parents were just trying to feed the kids. So they weren't able to participate in those same things. So one of the important things too that I wanted to be sure to share is if you have any concern about your brain, first, Medicare is religiously doing a small cognitive test when you go in for your annual. That is important. As annoying as it is to try to draw a clock, because very few of us are using an anagram anymore, that helps your doctor know whether to refer you for more testing. In the reversible dementia umbrella, that third one, that whole depression screening, if you notice there's like 3 pages and it's like, do you feel like doing the same things you used to do? You can lie to a point, but they ask you enough times that it's hard to hide if you have some symptoms of depression. We're trying to uncover the reversibles. Be forthcoming, be clear. We no longer have that disqualified for insurance, so that is a good reason to be clear. But if you're worried, clinical research is an excellent place to go. It's anonymous, and you can establish a baseline. I looked online, and now I live a bit from here, but you can do a 50-mile radius or whatever you're comfortable with. clinicaltrials.gov. You can always leave a clinical trial, but what you will gain is testing that you probably would have to pay for, but you won't have to pay for if it's clinical research. And in our area here, I noticed that like 5 of them were very activity-based. They weren't like injecting things that we don't know about. They were much friendlier. They were also about our family. So that's always a starting point for anonymity, maintaining your confidentiality in case anything were to change with Medicare or with insurance. You would have that protected information. We always encourage people to get a baseline. I got a baseline a few years ago. I'm hoping I'm holding, but I'm going to go back and do another test. Simple, not intense. It's a little difficult because I know some of the answers because of testing people myself. So those of us who do that, we're always wondering if we're going to be successful because we just remembered it, right? But so let's talk a little bit more. So the warning signs, if you think you're having abnormal brain aging, it would be the day-to-day memory changes. Familiar task. Often people get lost coming home from something they've done forever. Or I'll never forget a wife saying, "Those glasses have been in that cupboard for 35 years and he cannot find them." That's a sign, right? Disorientation in time and place. Judgment. We have a beautiful scale that I always train with. It's called the Functional Assessment Staging Tool. It is used in academia as well as in hospice to determine where you are. It's 7 stages. Many of our researchers and say the Mayo Clinic go with 3. 7 gives you more room, but it's very prescribed in what changes there are. And one of the early questions, which we don't ask anymore, but was, do you have difficulty planning a dinner party? Okay, not many of us do that anymore, right? But are you having difficulty repeatedly working with bills? With normal age change, you might forget a month's bill, but it won't be a repetition. It won't be a catastrophic. Remember, intensity and frequency are the signs. Misplacing things, yes, we do. We have the junk drawer, and all of a sudden at this age we have 3 junk drawers. That's not abnormal. Not remembering what the thing is for, that's a little more abnormal. And loss of initiative, that is very much indicative of that secondary form. Or that would be the apathy under vascular. But a loss of initiative is also a fear of failure. If I go out, I may not remember their name. Maybe I won't do it right at the restaurant. So that, and it's somewhat of a personality change. Frontal temporal dementia often has a severe behavioral change. Not the man I married. Okay, not the woman I remember. This is not my mother. These are all things indicative of a need for more testing. The testing is gentle. I've never met a neuropsych tester that wasn't amazingly attentive, as well as attentive to the family, which is very important. If not, that's where I come in because I do a lot of that family help. So the age-related changes. You may not remember something that took place a year ago, but you remember what happened yesterday, is a sign that it may be age-related. The acquaintance versus the family member we talked about. Word finding. Well, that does increase. Normal aging, you will have word finding difficulties. Sometimes it's stress. I know that for myself. I get stuck. And I used to be able to answer my husband over here while I was doing 2 things over there. And now I'm like, I can't answer you right now. I have these 2 things I need to tend to. So that is normal, that inability. You have less plates in the air. And the good news is maybe you don't have to have as many plates in the air. So that's exciting. One of the signs that I thought was fascinating, you're worried about your memory because you see what's happening, but the family is not. It's the opposite if there's dementia. Usually the family is worried, they're seeing all kinds of signs, and you are oblivious and somewhat hostile about their approach to you. That's ridiculous. I've done this all my life. You're seeing things that aren't there. And yes, Dad, you are seeing things that aren't there. So it becomes a challenge, and I think I always think of life as this big rock tumbler, and it's just that last little burr that we're trying to work off so that you're open to letting the family help you get experts to look at what is happening and getting a baseline. When you talk about language skills, We know that a person with dementia will have bigger gaps in their language, lots of pauses. So, or depending on the type of dementia, a spouse shared with me in caregiving support just yesterday. She knew things were wrong when her husband repeatedly called oatmeal granola. Now they're close, right? Oatmeal and granola. But it was the repetition that she saw something's not quite right. And then there were behavioral changes that were difficult. Reasonably so, why there is stigma. This is a wave of when you thought you were going to have a beautiful retirement with all these plans, and it is a wave of grief that comes at you. Grief is part of, sometimes you see caregivers that show signs of dementia, and it's because of grief. So when you look at that has to be pieced out somewhat, and that goes back to the depression scale and seeking a chaplain, somebody that you trust that you can talk to sort of kind of suss out what's going on with you. I was really grateful. I never thought I'd be grateful to be at Medicare age, but when I went this year, it was my first year, and I saw the cogs or the mini mental. It's, I think, an adapted mini mental, and I had to do the clock. I'm like, oh man, now it's my turn for the clock, but that is a good thing. Because I want to live as healthy as I can for as long as I can. And I need the help. I need someone looking deeper than what I can see. When you look at the dignity of diagnosis, this is a tough one. I have a little personal experience, a couple of personal experiences with family members with a abnormal brain change. There's a lot of denial, there's a lot of fight, particularly if it's a man. Maybe that's not true. Maybe women are just as feisty, but there's a sense of loss of freedom. And that's why we don't want to go anywhere, and we're going to continue driving until the police officer brings us home. So one of the ways that I have always suggested people do, and I've done myself, is to use that patient portal and communicate with your doctor prior to the visit. These are things I'm seeing, I'm concerned. Can you look deeper? Because even if you go with your spouse or your family member, they're not going to let you finish that thought. But you've preempted it, and so the doctor can do it with a little more dignity, right? And a little more finesse. And know what to look for, right? It helps, I think, here. We have some memory screenings. To show up at those is never a bad idea. You really can't go wrong with that. Also, doing your annual physical, because there's a tendency, all of us, to say, I don't need that. But it's very important for you to tend to what you can fix. There is so much research now on how to maintain a healthy brain. We know now that, yes, cardio is important. And I say that knowing that a large portion of the people listening are sedentary. Well, let's move the needle just a little, right? How can I move the needle a little? Maybe it's chair exercise. We know that meditation, mindfulness, prayer makes a difference, lowering stress. Not everybody's going to sign up for the yoga class. Tai Chi, we have seated versions now. You can look it up on YouTube. Trying different things. Years ago, we had this fabulous database called the Nun Study. And one of the things we saw actually was a Swedish twin study that they, in Sweden, they have documentation on your health from the moment you're born. So it's a beautiful data set. These were identical twins. They studied one with dementia, one that didn't have it. And what they saw was novel activity made a difference. I can't tell you how many times I've heard a spouse say, he's done the Wall Street Journal crossword puzzle all of his life. Try something different, right? It just a little bit. Now, I say that knowing that a portion of the folks listening are already dealing with dementia. They already have a diagnosis in the household. And they're not paying bridge anymore, but we can adapt things. We can make things simpler. We may not be able to go on the 12-day Panama Canal cruise, but we might be able to spend more time at a memory cafe reminiscing or looking at the Panama Canal or trying an evening at a Panama diner. We have to be very creative in how we keep that brain moving. Years ago, when I was a teenager, my dad had a second shift, and my mom would be working during the day. So I was kind of the primary cook. And I guess we were very stressful because he was always working with his ulcers. So I had to learn to make custard. And this analogy works for the brain. If you don't stir the entire 15, 20 minutes, don't walk away to answer the phone. If you don't do that, you ruin the custard. You've got to keep at it. You got to keep stirring it up. And I think that's true for the brain. Just keep stirring it up, changing things a little bit, knowing that routine actually proves to be very important to a person with dementia. But as we don't know if we have dementia, we need to try some different things. I have stories out the kazoo, but one of the stories that comes to mind is the woman who would not go to the memory care unit to live because there were all these old people there. She was 100 years old. Her daughter needed her to go because she was having failing health, but there were all those old people. Well, that's great if we have that set of lenses, right? That we feel that young. There's some beauty in denial. It just makes it hard for all those around you. So there is a lot of normal aging. I want to reiterate, those percentages are not that high. Now, we could be talking about non-age-related brain change, and that's really frightening when someone has early life Alzheimer's. We have that happening. That is frightening. We have just had the World Health Organization add a modifiable risk factor to the list, and it's air pollution. And we never had seen that before, but we now have enough data that we know that if a child adult is, and that includes being around smoking, that is a risk factor for the brain. Even 20 years ago, I would have said only early onset Alzheimer's is genetic. That's not true. We now know so much more. This is very much a genetic thing. The ostrich hides in the sand. My husband has both parents with a form of dementia. So we quickly got into, it helps that he married me, but we quickly got assessments, and we continue. And the good news for him is that the last checkup comparing magnetic resonance imaging, MRIs, in 6 years there had been no significant brain change. So mild cognitive impairment, something that you can find through assessment, often stays the same. And that's only 35% of the people with MCI actually advance into another or a more significant form of dementia. So we can work with that. I think that's a good place to be. Does that mean that he wants to exercise? No. Although the good news is I am the primary cook, so we are totally on the MIND diet. The MIND diet, check it out. It's still holding strong. And it took the Mediterranean diet, which was very brain-focused, and added the DASH diet, which was very heart-focused, put them together. Because mind and heart. I'm sure there's an old song about that. I want to thank you for joining us here today. I want to make sure that we are here if you need us. And our goal is for you to have a happy life no matter what's happening in your brain.